Welcome to Living Well. I'm so happy that you joined us today to hear about the highs and the lows of hypertension. Our blood pressure is one of the main functions in our body that regulates everything. And so today, our speaker is Josephine Johnson. She's a registered dietitian. She has many other degrees and masters of science. She'll tell you more about that. But Josephine has spoken to us before about cholesterol, and now today she's going to talk about hypertension. I want to remind you that this program is for educational purposes only. Yes, you can take notes, you can ask questions, but if you have any specific concerns, we do ask that you consult your personal physician or provider. Again, this is for educational purposes only. And I hope that you will learn one thing new today that you can take away and not only apply to your life, but that you can tell one other person. It's all about not only living well for yourself, but for others. Welcome, Ms. Johnson.
Thank you.
It's all yours.
Okay. My stuff on the screen. Okay, good afternoon, everyone. It's always a pleasure for me to do these presentations because this is my passion. And I hope by the end of the session that we would learn something new and all get a better understanding of high blood pressure. And what we learn, we would apply to our lives to make our lives more tolerable. We're going to start out with some statistics. We have global statistics, 1.13 billion people, and about half of that comes from unhealthy diet. In the US, we have about 40.8 million men, 44.9 million women. Blood pressure is also during pregnancy, can happen during pregnancy. Black women, almost 50% of Black women suffer from high blood pressure. Our young people too are involved with this hypertension. And those between 12 to 19 years, about 10% of those young people. And unfortunately, it can be hereditary. There are some pictures of some figs that I guess we have seen at some point. They're getting more and more modern, but some of these are used in everyday clinical settings to take blood pressure measurements. So what is blood pressure? Not high blood pressure yet. What is blood pressure? It's just the circulation, the pressure of the circulating blood against the walls of the blood vessels. And most of this results from when the heart is pumping the blood throughout our bodies. And if we use it with our qualifications, whether high, low, whatever, it often, this blood pressure refers to the pressure in the large arteries. And I took some time out to pinpoint to you the larger arteries in our bodies, the heart, the lungs, in our legs, groin area there, under our collarbone, by our ears. Those are the large arteries that are in our bodies. So high blood pressure or hypertension is the blood pressure that is higher than normal. And if it's consistently above normal readings, it may result in a diagnosis of high blood pressure. But I want us to be aware that blood pressure changes due to the involvement in different activities. We have some numbers here that the American Heart Association and the American College of Cardiology came up with in 2017. And now the normal is 120 over 8, less than 120 over less than 80. And if it's between 120 to 129 and less than 80 at the bottom is elevated. But then they begin to classify the stages, stage 1, stage 2, and you see the numbers there for the different blood pressure readings. And then when it's higher than 180 over 120, that's when they call it hypertension emergency. And either you call 911 or you see your doctor right away. Yes, this change I just told you about happened in 2017. But before that, a reading of 130 over 90, we see back there is now defined as high blood pressure. 140 over 90 and 130 over 90, they consider these, even though they may be lower, they think that at this low range, you can still have complications or damage done to the body. So that's why they carry it down to less than 120 over 180. So if you fall between these ranges now, 130 over 90 and 140 over 90 millimeters of mercury, they consider those to be high. And that's the change they did. The first change since 2003. So now they have eliminated the category of pre-hypertension. So no more pre-hypertensive. You either have it or you don't. This change in the guidelines now put 14% more people to be diagnosed with high blood pressure. They'll be educated about lifestyle changes and the possibility that some sort of medication might be prescribed. So what causes hypertension? Amazingly, the readings say that they have not found the exact causes, but there are risk factors that can cause this hypertension to develop. And two of them, they say that contributes to it mostly smoking and excessive stress. And you have other health conditions below that could also be risk factors for hypertension. Types of hypertension, we have primary hypertension. This blood pressure usually takes many years to develop and is probably the result of lifestyle, your environment, your age. Your lifestyle could be sedentary, your environment could be a poor diet or stress, and age more often after 50, going up to 60, 65, blood pressure is more common in those ages. We have secondary hypertension, which means that something can cause you to have it, like health problems or certain medications, family history, high salt intake, which we'll talk about later, smoking, stress, overweight, obesity, inactivity, and excess alcohol consumption. So if you're experiencing new, severe, or persistent symptoms, contact a healthcare provider. Most of the people are symptomless. That is why it is called a silent killer, while others may experience severe headache, shortness of breath, nosebleed, severe anxiety, and sometimes you may feel your neck, your head pulsing. So beware of those symptoms on a day-to-day basis. I came across something which I knew before called the white coat syndrome. And my doctor diagnosed me with that. Every time I go to the doctor, I get all flustered and anxious. So it's a phenomenon that happens when you go in a clinical setting. You get anxious. Normally your blood pressure would be okay, but when you go to the hospital, doctor's office, or something like that, your pressure goes up, but you don't really have high blood pressure. So doctor would just tell you, which he told me for about 2 to 3 weeks, take my pressure during the day, and it was just fine. So they call it the white coat syndrome because of the doctors in their white coat in some settings. There are medicines that can cause high blood pressure, contraceptive pills, steroids, the NSAIDs like ibuprofen and all those, cough and cold medications, some herbal remedies, especially those that contain licorice, recreational drugs, and antidepressants. But once you stop taking these things, your blood pressure may return to normal. So when you have high blood pressure, the arteries get damaged. The cells in the arteries get damaged. In the lining, they become narrow and weak. The heart now is not able to circulate the blood effectively. Therefore, we're going to lack, our body would lack nutrients, oxygen, the heart becomes malnourished, and it can't function properly. The same thing happened to our brain, our kidneys, our eyes. Some people end up being sexually dysfunctional. So your arteries, as we might know that it should be sturdy and springy and smooth to move easily, to move the blood easily from your heart to your lungs. Your arteries should be able to stretch just in case there's a sudden gush of blood that comes to that artery. It should be able to expand and accommodate that blood. If it is not able to do that because of plaque buildup and it is hard and stiff, that's when you get the bursts and they bleed. So keeping your arteries clean will help with the sudden rush of blood that goes through there. And I have an example of artery. At the beginning, it's normal. And as you look down further, it begins to close up. That is when the hypertension is going to start. And at the end here is very narrow. And there you can be diagnosed with hypertension. So which number is important? They both are important, but for some reason, doctors primarily focus on the top number, which I still have to find out why they do that. Because the systolic is measured when the heart contracts, and the diastolic is measured when the heart relaxes between the beats. So both are important, but doctors normally focus on the top one. Probably later somebody can shed some more light on that for us. So I just said that. Now the smallest blood vessels are usually the first to suffer the consequences of increased pressure because they are fragile and they may experience small amounts of bleeding, which can go undetected for a while because they're so small. And when they heal by forming clots. And the best place to detect this phenomena is in the back of the eye. And this can cause damage. It can cause hypertensive retinopathy. And the kidneys can go through this phenomena as well and start leaking protein, excess blood in the urine. And this is called hypertensive nephropathy. So we have to be aware of those little subtle things that can be going on in our bodies and we don't know about it. A heart, the picture, this one is a regular heart, but when you have hypertension and the heart is under stress, the heart's muscle becomes thicker. Over here, the heart is small. Here, it's bigger. It's like the heart is going to the gym to pump weight. So it's working, pumping, and then the muscle walls become enlarged and hard, and the heart becomes bigger. And then we have another health issue. We call that cardiomegaly. That's the big heart, all because of the high pressure and the amount of work the heart has to do. So there are some suggested ways to measure blood pressure. Some say measure daily at the same time. Some say use the same arm. Others may say use both arms to check. And it is believed that 10 to 15 points of blood pressure can be added or dropped depending on the hand you use. The heart is it begins on the right side. So you said, they say based on the right to left arm, it can drop 10 to 15 points. So I usually take it on 2 arms. The same position should be used because your blood pressure varies whether you're sitting or lying or standing or whatever. If your arm is up, down, or if it's bent, so check it the same time every day, or you can check it throughout the day. Do not cross your legs when you're taking your blood pressure, because crossed legs can add up to 2 to 5 points to the reading. If your bladder is full, it can affect your blood pressure because the kidneys will start to put pressure on the vessels in the kidney. If the cuff is too small, you can add some points. If it is placed over clothing, that can add some points as well. If you take it right after eating, it can add some points. So doctors usually say take it 30 minutes or so after eating. The stimulants, alcohol and caffeine and those things can affect your blood pressure. If you are talking a lot while taking your blood pressure, this can also raise the numbers. If the place is cold, it can also raise the blood pressure because your body is there working, trying to get you warm. So I went searching for the common blood pressure medications. There are quite a few of them. I just took some of them. 1, 2, 3, 4, 5, 6, 7, but there are more than 7, trust me. And I have in the middle their function, what they do: beta blocker, diuretic, calcium channel blocker, angiotensin converting enzyme. And on the far right, I have the effects, adverse effects of these medications. They cause rash, dizziness, depression, edema, nausea, pain, thirst, dizziness, tiredness, lightheadedness. And these adverse effects, they go on and on. Now I was looking through the news and I saw that some medications were recalled just this year. They were recalled because some of them have traces of nitrosamine, which is a cancer-forming agent if taken in large amounts. They also find in another set fragmented metal, impurities. So they have to recall them. Pfizer and several other pharmaceutical companies had to recall their medication because of these things in them. But the drug companies only seem to be interested in maintaining and managing the symptoms. They're not interested in health and healing. So they do whatever they have to do to get their monies. I was listening to a documentary last Saturday night, and this pharmacist said she used to work in this place and she had to stop. I think she said she had to stop because of what she was finding out. She said, statin drugs are a big lie. That's what she said, a pharmacist. Statin drugs are a big lie. They don't do really anything for you. They hurt you more than they help you. And one of the main adverse effects of statin drugs, she said, is impotency in men. And the same company that makes the statin drugs is the same company that makes the Viagra. So they know this is going to happen. So they give you something to counteract that. And this is what they're doing. You have a problem, instead of getting to the root of the problem and find out what's going on, they give you something to cover it up. So there are many reasons and factors why blood pressure goes up. And if the cause or the causes can be identified, it is highly possible that it can be resolved, reducing the risk of long-term damage. So the cause need to be identified. The body sometimes needs more blood flow based on what you're doing, and we all can agree to that. So one bad blood pressure reading on one specific day is a very faulty way to understand the issue. You can't just have one reading on today and then you give me drug today because the pressure was 130/90 or 140/90. The damage being done by high blood pressure may not be seen initially because of the microscopic level at which it is happening. If the scenario goes on unobserved for a while, it can lead to heart attacks, stroke, kidney failure, etc. High blood pressure numbers can sometimes be a symptom of an underlying process that may be harmful. So today, what is done is either lifestyle modification or medication, but they both work differently. Medication simply brings down the number and may prevent bodily damage, but does not make you healthier. It does not take care of the underlying process that may be going on. Medications are seen as an easy fix, and that is very sad. But when you do lifestyle changes, it make you healthier and may help to address any underlying process. This can also help to reduce the numbers. So, lifestyle changes that we can do, if you have extra weight, work on getting some of that weight off, because this extra weight, extra fat increases vascular resistance, gives the heart more work to do. The fat around the abdomen, they can compress the kidneys or other organs there, which in turn can lead to kidney problems or other problems. High body fat encourages inflammation, and excess fat in the body is seen as foreign. Anything foreign for the body, they're going to start the inflammation process. So fat, extra fat cells, or the big fat cells, how you want to put it, the body sees those as foreign and it will start the cascade of the inflammation process. So take your weight into consideration, get down as close as possible to your ideal body weight. That's a recommended weight for your height to help reduce the risk of these chronic diseases. And if you lose 1 kilogram, it can reduce your level by 1 milligram of 1 millimeter of mercury. Salt. Let's talk about salt, the diet. They're recommending 15 milligrams or less, as much as possible, but not too far because it can have its adverse effects. So the DASH diet, which is something people are using, is good for that. I think how it is the low salt, lots of fruits and veggies. Take out the refined carbohydrates, the processed foods. It's high potassium and calcium and magnesium, things that are good for your blood. And it can lower your blood pressure in as little as 2 weeks. Studies have shown that. As 2 weeks, and your blood pressure can be down. So DASH is dietary approaches to stop hypertension. That's the acronym. The typical American diet of salt is 3,400 milligrams or more per day. So the DASH diet says they limit it to 2,300. And they even say a lower sodium version could be 1,500 milligrams a day. So you can choose the version of a diet that meets your health needs, but it works. So it's a flexible eating plan, easy to follow. You can get the foods at the grocery. As I said, it's rich in potassium and calcium, magnesium, fiber and protein, low in saturated fat, and low in sodium. So salt, all salts are not made equal. The two famous salts that we usually talk about are the sea salt or the pink Himalayan salt. They also have the kosher salt. So those are good for cooking, and you can see where they come from. But when our salt intake levels are very high, the kidneys cannot keep up and ends up in the bloodstream, because salt attracts water. And when there's too much salt in the blood, the salt draws more water into the blood, and more water increases the volume of blood, which raises blood pressure. The volume of blood increases the pressure on the artery wall. So reduce our salt intake. And I have a picture of the salt I just spoke about. They're in the groceries. And some of us have been using them already. Kudos to you. Exercise is good, it's safe, it's an anti-inflammatory. 150 minutes of moderate exercise and 75 minutes of intense exercise per week. If you're taking medication, let your doctor know what you're doing. We're going to have natural blood pressure remedies now. So as I was reading, I found out that if the top bone in the neck is out of position, it puts pressure on your vagus nerve. Very important nerve, the chief nerve of the body, and it can cause your blood pressure to increase. So the chiropractor can put the bone back the way that they do it. So that's one thing I found it very interesting. Then you have the hawthorn. It's a botanical, it's a diuretic, helps with just water in retention. It's an ACE inhibitor, a beta blocker, a calcium channel blocker. So you see these things have the same effect as the toxic medicine that the doctor wants us to take. It relaxes muscles, reduces vascular tone, high in antioxidants. Get rid of all those free radicals from the body. Pomegranate. This is prevalent in the Caribbean. I don't know for up here, but I know we have pomegranate home, but in the stores they're very expensive. So it's an antioxidant and an ACE inhibitor. So it reduces the blood pressure by 5%. You have taurine found in those products. It pulls off fluid from the body. It lowers the ACE inhibitor, gets rid of toxins and fluids out and bring nutrients in. It's a natural antioxidant. Alpha lipolic acid, another natural remedy. And you can find it in your vegetables. And just eating a healthy diet would give you your supply of alpha lipolic acid. Magnesium also is a very good one to take. And it can be found in your cashews, avocado, green leafy veggies, dried beans, almonds. It's a calcium channel blocker. And it is believed that a lot of Americans are very deficient in magnesium. So make note of that as well. Now, sugar is not a natural remedy, but if you cut the sugar, it can help because excess sugar in the blood in the body leads to extra calories, which will end up as being fat stored. The body has a lot of problems now to pump blood around a larger body. So that is not a good thing. The kidneys will suffer. You might end up with diabetes, and the kidney will not be able to absorb the minerals, etc. And then dialysis, if the kidney is not functioning because it has been damaged by high blood pressure or the diabetes, some people end up on dialysis. Okay, so don't give your body extra work to do. Yes, we can have some sugar, nothing is wrong with that, but for a while, just leave the sugar, eat natural, your fruits, etc., and get yourself together. So what is my normal? It's less than 180, 120/80 is ideal. But everybody shouldn't be put in the same tub, saying this is what your blood pressure should be. Some person would be higher, some would be lower, but everybody's treated the same way. They place in this universal basket and given medication. So if you have a discrepancy in your reading, it should be done again. Again and again. And if it's consistently high, then, as I said, some persons may need the medication initially, but after a while, you can wean yourself off with your doctor in it, or your whoever is advising you. You can wean yourself off of the medication. So if my blood pressure is 130/90 and I don't have any low level damage, my eyes are good, my kidneys, they don't show any sign of malfunction, and I'm fine, my everyday, no distress, my 130/90 is my normal, and that is my blood pressure. Some people may have 140/90 and they're good, nothing is wrong. That's just how they are. We're all individuals, and we're gonna have different blood pressure readings. Well, the doctors see, well, I have to do my job, so they give you blood pressure medication. So who benefits more from the prescribing of medication? Surely not the patient. And we know who benefits more. Okay, so be aware. And when you go to the doctor and your blood pressure is high, as they may put it, you go home and you test it and write it down and ask questions. Don't just take the medication. So there's a better way. the natural remedies are better than pharmaceuticals. But we have to decide which route to take. So consult a healthcare profession about your course of action. They have natural remedy doctors who will be able to give you like a certain dosage or how much you should take per day. See if you find somebody who does that, or do your own reading and see if we can lower the amount of pharmaceuticals that we take. So God has given us sources of knowledge to which we can turn. In his word, health professionals, nature, etc. He wants us to prosper and be in good health. So let's use these resources to help us live a more tolerable life. Thank you. That's the end of my presentation.
Wow, very informative, Ms. Johnson. Thank you so much for taking us through that. I actually learned a lot about the natural remedies and how we can actually consider using those to help manage our blood pressure. I think it's very interesting. At the beginning, you talked about causes of hypertension, and you talked about smoking, and you talked about stress. And I think sometimes people minimize that when we don't let our body rest between stress, that it actually is what is one of the main reasons why people could be having those symptoms or those readings. Let me open it up to the floor. I think there may be people who may have some questions. Let's see, feel free to raise your hand to let us acknowledge you if you have some questions about the information that has been provided today.
Yeah, this is Emlyn. I just want to tell Josephine how informative her presentation was. I have learned from it. Now, I guess you were asking about why doctors focus so much on that systolic pressure. I guess research have shown that patients with high, patients with high systolic readings have a greater chance of having stroke and heart disease. So that's why I think they focus more on the systolic. But both systolic and diastolic needs to be within the normal range because, you know, as you mentioned, Josephine, the diastolic is when the heart is at rest. And we don't want our heart when it's at rest, it's still in there's so much stress. That's when the diastolic is red. And also the systolic is when the heart is pumping. So we need to keep both numbers down. But I think that's why they focus so much on the systolic.
Yes, I agree.
You know, there was another thing that you brought up about small vessels that can be seen in the eyes. And a lot of times when we go to the eye doctor, they want to look behind, shine that light in, they want to see. And I remember my ophthalmologist telling me that many times the eye doctor may be the first person to tell someone they have hypertension because they see the damage or what's happening with the vessels behind the eye. So the reason I bring that up is because sometimes we forego our eye exam. You know, we don't think we need to do it every year. But again, that may be one of the, it may be you may actually receive a diagnosis, or at least they can see to make sure that those vessels in the eyes are intact and functioning well. Any questions for Ms. Johnson? So the question I have on the line is, does everyone have a blood pressure cuff in their house?
I have one. And it's good to have one.
It is. If you do not have one, advisable to have one. So in the event you begin to have either, you know, headaches or palpitations or anything like that, it would be easy to check your blood pressure, see where it is. And I think she gave the parameters, what it should be. And if it's extremely high, it is a 911 emergency. Do not drive yourself anywhere. call them so that they can treat you, because you could be driving. If the blood pressure is not managed or maintained, it could continue to climb. Any questions? Thank you, Alicia. You have one in your home. Anyone else? Any other questions? Well, I must say this was very informative. I've worked in healthcare for many years, but I always learn something more when I hear about hypertension or any of the diseases. I think on this Living Well, we want to encourage people to prevent these diseases, prevent them from happening. But if you have it, there's ways to reverse it. And I'm glad that Ms. Johnson shared natural remedies. I actually, many times they'll tell you if you're taking any type of hypertension medicine or high blood pressure medicine, do not eat grapefruits. Oftentimes you'll hear that because they are a diuretic and they could help bring your blood pressure down along with that medicine, and you could have another crisis because now it's too low. I've also heard that if you have hypertension and you put your feet in just regular room temperature water, sit there about 45 minutes to an hour, it will bring your blood pressure down. Now, these are intermittent things that you can do. They may not be a long-term solution, but they certainly can be starting points that, and I've actually done it before myself, put my feet in water, not hot water, not real cold water, just a little room temperature, and sit there, read a book, relax, and the blood pressure will come down.
Question. I noticed that she mentioned different types of salt, but these salt that she mentioned, do they have iodine in it? Because I know that iodine is important for our body function, especially for thyroid function. So those salt that she mentioned, do they have iodine in them? Also about the water, you just mentioned about the water for the high blood pressure. How often would you suggest that we do that, soak our feet in water?
The pink Himalayan salt, it says it has iodine. The sea salt does not, but we can get iodine from our food. The reason that they're stressing these two salts is because they contain less sodium. They don't have any chloride. The table salt is sodium chloride. Table salt is processed, is washed, bleached, chemicals added, like the chloride. So that is why they're promoting the sea salt and the pink Himalayan salt, because of the low sodium that they have.
You said the no sodium?
Low.
Low, okay, thank you.
They're low in sodium than table salt. But table salt has the chloride, and that is the problem there in a big way, with chloride in the table salt, which is not in the other two salts.
And then to your question, in response to your question regarding soaking your feet in water, again, it depends on if your blood pressure is high or how often it's high. I only do it, I haven't done it in a while, but when I was trying to manage my blood pressure, I would put my feet in the water and just sit there and read a book. And I think a lot is more of relaxing and calming. And I'm sure the water has a way to remove toxins from the body as well. But it just depends. And you can do, I used to do it even when I didn't have hypertension. I used to do it when I got home. It just felt so relaxing, so it's up to you how often you want to do it. But I would check if you have hypertension, check your blood pressure before you soak your feet, and then that 45 minutes or hour after, and see if you see a difference. Because if you see a difference, then I would say continue doing it. But if you don't see a difference, I mean, you may be relaxed, but it's not affecting your blood pressure.
Okay, thank you, ladies.
Yeah. Hi, this is Juliet. I was shocked to hear that a full bladder will increase your blood pressure.
Yes, because when your bladder is full, your kidney is pressing on those vessels. The blood vessels in your kidneys are being pressed by the urine. And anything that hampers the flow of blood throughout the body can increase your blood pressure.
So
If you cross your legs and blood can't flow properly, that will increase your pressure.
yeah, I know about the crossing of the leg.
Yeah.
So now when I go to the doctor to have a good reading or probably a true reading, my
Mhm.
bladder should be empty. So I learned something new.
And put on a sweater because in there always cold.
Oh, okay. Thanks for that. I didn't realize that.
And no talking.
Yeah,
Just sit and let them take your pressure.
okay.
Miss Lee, I see your hand.
Yes, so thank you, Ms. Johnson, for an excellent presentation on hypertension. Really appreciated it.
Welcome.
So Dr. Sankey, you mentioned about the grapefruit. Also grapefruit, if you on cholesterol medication, is also not a good mix. So another reason not to use grapefruit.
Yes.
Well, and a lot of times I say we're willing to take the medicine, but not the natural. So
Yeah.
like when people say, I can't eat that grapefruit because I'm taking medicine, I say to them, why not eat the grapefruit and not take the medicine? Of course, you follow your doctor's order, but we're so willing to accept a synthetic than the grapefruit, because the grapefruit actually can help with regulating your blood pressure. But I know exactly what you're saying, but I was just saying many times we could possibly manage our blood sugar and blood pressure with natural ways. And I know garlic is also good for the blood pressure.
Yes, yes. Yeah.
I thought I saw another hand. But to your point, Ms. Lee, if you're on, you said statins or any blood pressure medicine, no grapefruit. All right. Any other questions or comments for Ms. Josephine?
Iodine.
The iodine?
Yeah, the iodine. I was just going to say you can get your iodine from seaweed.
Yeah.
Any seaweed, yeah, because that's how I supplement my iodine, because I use the Celtic salt. So iodine, you can get your iodine by using seaweed, kelp, granulars to help with your salt intake, to add to your salt. So there are other means of getting iodine besides that iodinized salt that has chloride in it. Chloride is one of the things that affect our thyroids. Bromide, chloride, all those rides, it affects our thyroid. So we have to be very careful not to use those products, things that has chloride in it, and bromide, and
Mhm.
all of those ides.
Jocelyn, did that answer your question? Because I see you mention, what would you say to a person with thyroid issues and the use of salt with iodine in it? Did that answer your question with what Ms. Simlin just said?
The Celtic sea salt only has a trace of iodine. So if the Himalayan pink salt has no iodine than the Celtic sea salt. So if she wants to use the Celtic sea salt, but the table salt has quite a bit of iodine in there. And she can get, if she wants more iodine or what, she can get it from the foods Emily mentioned. Anybody wants more iodine?
All right, well, want to say thank you again and again, Ms. Josephine. She does her homework, she does her research, she brings new knowledge, and that's what it's all about, living well, new knowledge. I would encourage you to share this information with your friends and your family, those who may not be on the call. As I mentioned before, our main focus is to prevent diseases. Prevent them, reduce our risk of getting any type of diseases. And if we already have them, how do we preserve our health and how do we manage it better? And then we want to prolong our lives. So we want to not only live well on this earth right here, but we want to live well so that we can prepare for heaven. So thank you again, Ms. Johnson. Next week, we have a very interesting topic. I'm not going to tell you what it is. It's one that we have never, ever, ever done in this program before, but I think you're going to find some new information that you will find very valuable. So we are going to close this segment of the program out, and then we will actually allow you to give us any prayer requests that you may have.